Hello, thank you for watching Spotlighting Jonesboro on Channel 24. I'm your host, Jack Turner. Heart disease is the #1 killer in the U.S. More than 350,000 deaths occur each year as a result of sudden cardiac arrest, or SCA. In fact, SCA claims one life every 2 minutes, taking more lives each year. To decrease the death toll from SCA, it is important to understand what SCA is, what the warning signs are, and how to respond and prevent SCA from occurring. More than 65% of Americans not only underestimate the seriousness of SCA, but also believe SCA is a type of heart attack. With me today is Dr. Rosie Gilliam, electrophysiologist, a mouthful, with the Cardiology Associates and St. Bernard's Healthcare Center. Doctor, how you doing?
Doing well. Thanks for inviting me today.
Absolutely. Dr. Gilliam, what is the difference between sudden cardiac arrest and a heart attack?
Well, what we think of traditionally as a heart attack involves an artery being blocked. And when that artery is blocked, blood flow to part of the heart stops. And that part of the heart dies. Now that's a heart attack. We talk about cholesterol, exercise, we talk about chest pain. All of those are associated with a heart attack. When someone who suddenly dies, we often say, oh, they had a massive heart attack in day-to-day terms. But actually what happens there is the heart's electrical system starts to become haywire. It beats either very, very fast. We're talking about heart rates 300 to 400 times a minute, extraordinarily quickly, or the heart actually stops. Now, point of fact, when you see the things on TV that people say cardiac arrest, we always think about the heart stopping and you shock the heart to get it started.
Right.
But actually the heart's beating out of control very fast, more than 95% of the time. And so what we do is we shock that person and it restores an orderly heart rhythm to them, and that's the electrical system. That's what sudden cardiac arrest is. It's a disruption of the heart's electrical system. Now this is huge in numbers. We're talking almost 400,000 people every year. Wow. This is by far and away, you'd have to add up all the causes of cancer to equal the numbers that die of sudden cardiac arrest.
Staggering.
It's huge.
So who should be concerned about it?
Well, the people we immediately know should be concerned is anyone who's had a heart attack, obviously, because they've had damage to their heart. Right. But we also know that people with what we call a low ejection fraction. Now, the ejection fraction is a measurement your doctor can make using either an echocardiogram, which is an ultrasound for the heart, or cardiac catheterization if you've had that, or a number of other studies. This measures what percentage of blood is pumped out of the heart every time the heart squeezes. The normal heart pumps about 50% out every time. So we would say that person has an EF, or ejection fraction, of 50%. Right. Now when that number is below 35%, we know every one of those people would benefit from having an implanted defibrillator. Now implanted defibrillator does the same job that we see on TV that the paddles do, except it's implanted under the skin. And it's sort of like having the rescue squad in a can. It's there to follow you around. If you need it, it will shock your heart and save your life. And as I tell people, it's not preventing a heart attack.
Right. What
What it's preventing is sudden cardiac arrest and you dying from it.
Now, if I get the implantable defibrillator that you're talking about, are there any limitations that would have upon my life?
Actually, people have all these things about pacemakers and defibrillators that you can't get near microwave ovens. You can't do these things. But the point is, that's old wives' tales. It's not true. Mostly, I tell people the only thing we limit them to is in the medical environment. An MRI scan right now is one of the things we tell them they cannot do. But beyond that, there's really no limitations to what you can do with the device. I mean, in fact, I tell people the goal is to forget it's there, to get about your life, be fully active, but yet protected.
Sure.
So absolutely. You can do all these things, and if you do have a problem, it's going to save your life. But in the interim, get out, do everything that you want to do. Don't let it slow you down.
Absolutely. No, I tell you, if that was the case with the microwave, I'd be in bad trouble.
Most of us would be. But as I tell people, just imagine if a microwave was that unsafe to a person with a device, it would be that unsafe for all of us. So realistically, there are a lot of folk legends about how these devices limit you. But the truth is, the devices do not limit you. The diseases often limit people. And this is a very serious problem untreated. But once it's treated, we now will take something that will be a 95 to 100% chance of dying suddenly to being a 95 to 100% chance of having no significant problem at all. I mean, a matter of fact, this morning, a patient actually received a shock from his defibrillator, and he would be dead without it.
Right.
I mean, and this is a story I see almost daily. So the biggest problem we have is to recognize this. Mm-hmm. So we have to recognize that this is a person that needs treatment, because the scariest thing to me as an electrophysiologist is to recognize that while we treat a lot of patients, only 1 in 5 patients who we know needs this type of treatment actually ever gets it.
Right.
And this is something that's very critical, because a lot of times people don't think about this. They've survived a heart attack. They're glad they're doing well. Mm-hmm. And, people want to wait till they have pain. Mm-hmm. I said, Doc, I don't hurt anywhere. I hear this many times. I don't feel bad. I feel good. I don't hurt. I'm glad. I don't want you to feel bad. Right. But this is not a problem that you can feel bad for. Sure. If you wait to your first symptom, that unfortunately could be your last.
Sure. Now, you just mentioned symptoms. Are there any types of symptoms that go along with this?
Well, if in a few cases people will have lightheadedness, mm-hmm. or they may actually pass out. Mm-hmm. When people pass out, that's a very serious concern.
Sure.
There are a lot of, I think teenagers and young people who have what we call faints. I think every Southerner is familiar with the Southern swoon. You're allowed to, oh my gosh, I see something distasteful, and a woman falls in the arms of her lover who's standing there to catch her.
Right.
All that, we laugh about it, but
right.
that's actually a real problem with a lot of people fainting.
Right.
But I'm not talking about fainting. I'm talking about someone who's actively doing something and suddenly falls down.
Sure.
That is a clue that there perhaps is something wrong. So these patients may need pacemakers, but they may be at risk for sudden cardiac arrest and may need a defibrillator. Mm-hmm. So if someone passes out, that's something I take very seriously.
Sure.
Lightheadedness, fast heart rates, or irregular heart rates are things that you should see your doctor about. I'm happy to say that most irregular heart rates aren't serious, so I don't want someone to think, oh, I got a little irregularity to my heart,
Sure.
I'm at risk. But
sure.
That's not the case. But serious problems that leads to lightheadedness, or certainly change in the way you think, or falls, those are patients who are certainly at risk for being concerned about sudden cardiac arrest.
Sure, and it's always better just to get it checked out. I mean, if you suspect it, it's better to be safe than sorry.
It absolutely is.
So.
And by the way, October is Sudden Cardiac Arrest Awareness Month.
There you go.
Now, this is something I'm making a big plug for. Apologies to the breast cancer awareness folks, because we share the same month.
Sure. And
breast cancer, of course, is a significant problem. We know about it, and we hear that 18,000 women are at risk of dying this year for breast cancer in this country. Mm-hmm. 190,000 are going to die from sudden cardiac arrest. So as big a problem as breast cancer is for women, 11 times more problematic is sudden cardiac arrest. Mm-hmm. So this is by far and away the #1 cause of death for women as well as men. So our stereotype of the person who dies suddenly is the overweight, executive, hard-driving, middle-aged man. But recognize women die of this as well.
Sure.
So this goes across all races. It goes across, sex. It goes across ages. We see young kids who die suddenly playing sports.
Right.
So this is something we want to raise the awareness of people so that we can do something about.
Sure. Now, you're an electrophysiologist. What
Right.
exactly is that, and then how does that relate to the sudden cardiac arrest?
Right. Electrophysiologist, I'm a special type of cardiologist. Mm-hmm. So the first thing you become is a cardiologist. And so I am familiar with heart attacks and what I call the plumbing part of the business, but receive further training in just the electrical portion of the heart. Mm-hmm. So electrophysiologists are a special type of cardiologist who deal only with electrical disorders of the heart. We are lucky to have 2 here. We have 1 other in addition to me in Northeast Arkansas, and we are very focused to work with our cardiologists and primary care physicians to address particularly electrical disorders of the heart.
Sure.
So not only do we worry about sudden cardiac arrest and defibrillators, but we worry about any irregularities of heart rhythm.
Okay. Well, Doctor, thank you so much for sitting in with us. I hope everybody got a lot of information from that. If you suspect it, some of these signs or symptoms are affecting you, certainly go see your primary care physician and get it taken a look at. And if something comes about it and it's a little more serious than what they think, then they'll probably be coming to see you.
Well, that's exactly the way to do it. Thank you very much for having me.
Absolutely. And thank you guys for watching Channel 24.